So welcome, get what you need to eat, sit down, and we're going to get rocking because I have a very valuable guest and I don't want to waste her time. Me, on the other hand, you can waste my time. I really don't care.
A couple of minutes, there's a ton of food in the back. For the next couple of minutes, there's a ton of seats in the front.
All right. Maybe 10 years ago, I would be jumping back and forth. In my 60s, I'm going to walk all the way over here, get down to the podium, then walk back. That's what happens when you get old.
10 years ago, I can't.
So let's get seated, folks. And then I'm going to code switch and get into official presentation mode and voice. Good morning to you all. And I want to welcome you. This is PHMC's celebration of what I would call a very necessary point in every year, just to rethink our commitment to the legacy of Black people in the United States, our contribution, what it means today, and especially being focused on what I will argue is the most challenging time I have faced in my lifetime besides the 80s in terms of social services being attacked in a very aggressive and effective manner. And that's non-political talk, but you know what I mean. So let's begin now. Now, you know, as we begin anything, I have to start with a PHMC commercial. We're going to inform everybody about a few things about our organization. And for the record, PHMC is Public Health Management Corporation. And PHMC is the largest health and human services organization in the region and Public Health Institute for Pennsylvania and Delaware. And we've been around since 1972, over 50 years. And we've been building those healthier communities through outreach, education, research, direct services, and partnerships with government. Now, foundations help out, businesses occasionally help out, but more importantly, we need support from the community because many of the intermediary work that's accomplished by PHMC is through a litany of small nonprofits on the street delivering those services. And that's important to the DNA of making healthier communities. Now, all the folks that you see here at PHMC service a group we will use in air quotes has many being from underserved communities. Now, I hear all these euphemisms. You know, it's sort of like in the 80s when they said urban radio. I was like, what are they talking about? WHAT and DAS? The code switching. But when we say underserved communities, we're meaning Black and brown. And those folks can reach numbers as high as 76, 70, 80, high percentages of the client base in any particular program. And that's important because it ties into what we're going to talk about today. Given our size and scope, it's crucial that we leverage that, but we need the voice of those communities. And sometimes that voice comes through individuals, but the voice can also come through what we will call Black media for purposes of this discussion. And a representative of Black media is what we'll call WURD and the Tribune, the Sun. They're all examples. We look to them not only to share our stories and resources, but to, as I mentioned before, stay informed. And WURD offers a unique lens into those communities we are, in theory, serving, as well as drawing employees, having locations, because we have over 70 locations, which are around this Delaware Valley area. And many are in the neighborhoods that we serve. So the news outlets in these neighborhoods have a unique view. And I'm going to treat today as, you all know Sonny Hill, famous journalist, former basketball player, Sonny Hill League. He has an expression where he's in the living room, right? On his weekend radio show. Well, today we're going to be in the living room. What does that mean? I'm getting rid of this damn jacket. I'm getting rid of this tie. And I'm getting ready to talk to an old friend. Or excuse me, a young friend who I've known a long time. So this is going to be a very personal introduction for me, because Sara Lomax is a giant nationally as well as in our area. And she has done some things. She's an award-winning American journalist, media executive, and entrepreneur. Comes from an entrepreneurial family. We'll get into that a little later. And she's currently the president and CEO of WURD Radio. Raise your hands if you listen to WURD Radio.
Oh,
Some of the best intellectual dialogue regarding what's going on in our neighborhood. And for the rest of my PHMC coworkers, when I use the euphemism our neighborhood, I'm referring to the African-American neighborhood in the general area. Code switching again for you quickly. So, what does WURD Radio mean to us? Well, it's not just WURD Radio, though, because after her family purchased that radio station in 2003, Sara went on to do some accomplishments on her own. She's the visionary and co-founder of URL Media. It's a network of Black and Brown owned media outlets. Now, Sara, her undergraduate years were done in an esteemed institution that has created great minds, the University of Pennsylvania. And then she went on to attend one of the nation, if not world's, premier journalist schools, and that's Columbia University. So not only is she prepared by being in touch with the community and her family legacy, she's honed that with formal education to prepare her for what she does. And as we know, many people of color know, being over-prepared is something we find as a necessity whenever we do anything. It is not to take a knock at society, it's just being truthful in terms of us being prepared. And this woman is prepared. So I mentioned that it's a little personal. I had the pleasure of being a classmate of Mary Claire Lomax, Esquire, the CEO of the Lomax Family Foundation and general counsel to Lomax Companies. Her sister, we lost her in 2022, but she was the very first non-football player I met in 1980 at the University of Pennsylvania. And she introduced herself as Claire, I'm a field hockey player. But that showed me, I had not heard of the Lomax family despite their presence, but it was access to, and for African Americans, legacies of activism, entrepreneurship, and commitment to the community, which generated philanthropy and a presence in our community that cannot be undervalued. And I say that because that legacy, and I'm going to bear with me, I got to get a little history lesson. It's not Sunday preaching, but I got to let folks know that her father, Walter P. Lomax Jr., was an icon. He was lost in 2013, but he was a physician, health administrator, philanthropist, and ranging from 1960 to 2000, he established a network of clinics that grew to 22 physicians and quickly grew to a much larger entity. And the Lomax health systems managed clinics around the country. And in the 1990s, the healthcare workers, I believe, supported 70 correctional institutions in 10 states. They expanded into real estate and other things. But there's a relationship here. Many of you heard of the consortium, and you think of John White, Jr. has, the person who headed that. Well, John White Jr. before that was an executive public servant, but he was also the former Pennsylvania State Secretary of Welfare. And that job was instrumental under the Casey administration in generating opportunity for African-American professionals to serve in a capacity for the state of Pennsylvania. And a very important marker. We see his son, Kellen, around here, but I want us to know collectively where these folks popped up from, what they contributed, and historically note those contributions. And the Casey administration was ground changing for inclusion in this state. And we shouldn't lose fact of that historically. So I'll start with my little history lesson. We're going to move into what we will call the fireside chat. I'm going to rename this multiple times, so just bear with me. But we're going to get comfortable on stage. So Sarah,
Yes.
are you ready?
I'm ready.
All right.
Hi, everyone. And I always brace when somebody says, how many people listen to WURD? So I'm like, oh, God. So I appreciate, even if you don't, that you raised your hand because it made me feel good. So it's nice to be here with everyone. What's that?
A member.
And a member.
Member.
And actually, today we're doing a radiothon to kind of help us build support for the station. So tune in. You can hear a little bit more about that.
All right.
All right.
Are you ready to fire up with that first question? You ready?
Me? Yeah, I'm ready.
All right. All right. All right. Many years ago, I had the good fortune during the Obama years to go to Cuba. And I noticed a lot of Black folks in Cuba, right? People look like me. And I started digging and I got some numbers. They had lower infant mortality, longer life expectancy, and also just fared better from a health perspective than the comparative numbers of African Americans in Pennsylvania. And Pennsylvania is largely the same size, population, and land mass as Cuba. So, again, I'm going, man, how come Black folks, they're living longer? They have less infant mortality. And then I learned later, I started learning words like health disparity. And getting things, awareness about these disparities, I wasn't getting from the mainstream media necessarily. So can you help me understand what the role of Black media is in advancing that type of understanding for our community and the community at large?
Sure. Well, first of all, thank you to you, Michael, and to Gloria for inviting me, and for all of you for attending. So I've been a Black media entrepreneur my entire career, and that spans back to the 90s. And my first media endeavor was launching the first Black health magazine that was consumer focused. It was called Health Quest magazine. And my father and mother were my investors in that. And I co-founded it with this brilliant journalist in Atlanta. So I was living in Atlanta at the time. Her name is Valerie Boyd. God rest her soul. And so, like, very early on, I grew up with a father who was a physician who built clinics, full service clinics in underserved communities, starting in South Philadelphia. And what I remember as a child, because we would have to work in his offices during the summers, and these were offices that were engines of employment and business in those communities, as well as providing all kinds of services. It was primary care, it was OBGYN, there was a pharmacy there was ophthalmological care, there was podiatry. It was everything in one place. And that was in the 70s. And now, healthcare is so fragmented. You have to go one place for this and one place to get your blood work. And so I was raised in an environment understanding the importance of making healthcare accessible, and culturally competent, because my father's patients loved him. And so when I became a journalist and had developed my career path to go into media, I recognized that all of the issues that we as Black people face, whether it's housing or poverty. I remember I asked my father, what's the number one health issue? This was years ago in the Black community. He said poverty. This was before social determinants of health. This was before racial health disparities were coined. And so, I knew very early on that communication, information, and who delivers that information really matters. Context matters, because we have a history that is fraught with distrust. We have the Tuskegee syphilis experiment that created unbelievable trauma in the Black community in terms of our ability to trust public health systems and to trust the healthcare system writ large. And so, when I published Health Quest magazine, that was my first foray. And what I understood was that people want to understand real lived experiences. All of the statistics, all of the clinical conversations are great, but what really resonates with people and moves people are personal stories and really understanding that people care. And so after I published this magazine for 10 years, and then I closed it down in 2002. My father started the acquisition of WURD in 2002, was finalized in 2003. And I had closed my magazine down after I had put all my energy into it. I was very sad that it did not work. And I was invited to do a show on WURD when it first launched. And I did Health Quest Live, which was a radio version of my magazine. And so what I found and what we have seen over the years is that cultural concordance, which is like a new term, really matters in the health outcomes of our communities. And trusted messengers, trusted platforms, they make all the difference. And ownership matters. We are seeing right now in the country where media ownership is being threatened, it's being coerced into doing things that are not necessarily in the best interest of its readers or its consumers. And so I really believe that having independent media, independent Black media in a city like Philadelphia makes a tremendous difference. And we have done a number of really powerful health communications initiatives, one around colorectal cancer called Go to Know. And it was great. We saved some lives, and it was complex. And I'm not going to go into all the details of that, but we've done things around glaucoma, clinical trials recruitment so that Black folks could have access to cutting edge care. We do regular programming on our airwaves around health and wellness, and it makes a difference to be able to have that engagement. That's the other thing. It's a two-way talk platform. So there's this beautiful thing with talk radio. There's an intimacy and an anonymity. So people can call up and ask questions where they may not feel comfortable doing that face-to-face with someone. So we have a range of things that we are doing to try and address the racial health disparities, the racism that infects the healthcare system and contributes to the negative health outcomes that you referenced at the outset compared to Cuba.
If you can indulge me as an old guy and a fan of history, can you talk a little bit, and I know I didn't give you a lot of time to prepare on this one, but your father's initial practice and many other African-American institutions were along a strip of Christian Street, which was a mecca for Black healthcare providers, even pharmacy. Dr. Richardson, I was friends with Vita and Vicki Richardson. He was the first Black graduate of the School of Pharmacy. When that was displaced and integration happened, was there an effect in terms of messaging where we had concentrations of Black doctors and health professionals, and when it was homogenized through integration, we lost a connectivity in terms of knowing and understanding what our community needs were?
I mean, I think there are a lot of challenges that arose with integration. There were also opportunities that arose with integration. I mean, like, bottom line, Black people should be able to live and shop and eat and do whatever we want, wherever we want. And so, you know, there are definitely, there are historic Black communities that suffered as a consequence of integration, for sure. And some of that displacement, I mean, we are living it now because they're, you know, like I guess gentrification is our modern day, you know, way of looking at integration. But I think that the reality is we have always had powerful Black physicians. We've got the National Medical Association. We've got the Medical Society of Eastern Pennsylvania. That's the local organization of Black physicians. We have resources. WURD has put together a community health and wellness directory that is a directory of physicians that serve the underserved. And that is, you know, physicians who, Black and brown and others who are committed to public health and equal access to quality healthcare. So I think that I mean, there's so many challenges related to our current healthcare system that impact Black people. We look at the Affordable Care Act and the fact that that's being, you know, dismantled, or it's being attempted to be dismantled. So, you know, we also have to look at the things that are working and the things that we can lean into. And I believe that one of the things that we can do and that I have control over is increase and provide as much health content and coverage and access through the events that we do, through the digital outreach that we do, the on-air coverage, the, you know, video coverage. So today, media is ubiquitous. You can, I mean, it's fragmented for sure, but WURD is what you call legacy media. But you have YouTube University. You've got so much access that has been democratized because of social media. There are problems with that, but there are also opportunities with that, because a lot of people can provide information. You can access information in ways that we have never been able to access before. And so, you know, I think that we have to look at, take the good with the bad.
That's a perfect setup for this next question. Part of the mission here at PHMC is health promotion. And you've been very successful, as well as other Black media outlets, in terms of promoting campaigns, getting out the word. So can you share with us lessons we can learn in terms of that health promotion and how effectively it can be used in radio as the medium for delivering that messaging?
Well, I mean, the messenger matters. That's probably the most important factoid that I have found, is that, you know, the way that, because of our history and the fact that, and Tuskegee is just kind of like the most well-known example, but there are examples like right up to today where incarcerated people are being used as guinea pigs. I mean, there's so many, the lack, I mean, look at the maternal mortality rate for Black women. I mean, the stats say a lot about, so Tuskegee is the example that a lot of people can resonate with, but there are many. And so the trust issue is real. And so trusted messengers. And so like you can, and so the messenger matters and the context matters. So we can have a physician on, we have the twin sister docs on every week. And these are two Black women, twins, who are physicians, who are on every week providing updates and news and information about health and wellness. I am going to, depending on your lived experience, I am going to hear their information different and believe it differently than if I hear somebody who is not culturally concordant, I'll say. And so I think that, and then we can say things, you can say things on our platform that people will hear differently than if it's on WHYY.
So
I mean, real talk, people, one of the things that we have worked very hard to do over the 16 years I've been running WURD is to develop this trusted messenger status. We don't have the biggest audience. We don't have, the biggest signal or anything, but we have trust in the community because we have been honest brokers. We have been committed to centering our audience at the forefront of everything we do. And so our listeners, when they're listening to WURD, they are predisposed to believe what is being shared on that platform because they know that we are a trusted broker.
I have a humble request.
Yeah.
That we can work together more with you in a responsible way.
Yeah.
And specifically looking at our Cedar campus, which is at 54th and Cedar. Misericordia in my youth was that hospital. My grandmother was a couple blocks away. But we have Anya and can you raise your hand? She represents our community outreach. I would love, and Nikki can, and the other members of the communication department, let's make a conscious effort to focus on a community outreach where you do that live broadcast. We'd love to do that at Cedar and have an opportunity to highlight where we can work together. And I think you made mention to some of the experimentations, the antifungals that were done at Graterford Prison. And again, apologize the old man suggesting some things that can help us learn more. I recommend Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present by Harriet A. Washington. And Sarah's seen my library. All the stuff I'm recommending, I've read. I say read that book for a crash course on what was done in terms of medical experimentation.
Yep. Yeah, that's a fantastic. Harriet Washington is a brilliant journalist, like healthcare medical journalist who has done tremendous research and work. So, and I think that for public health professionals like the folks in this room, I think reading any kind of American history, Black history, whether it's The Warmth of Other Suns or Caste or any of these things, and realizing that everything that's being painted lands in the healthcare system, lands in our bodies, lands in our minds, lands in our hearts, and that translates into how we process health and well-being individually and as a collective. And so I just think that, as we're looking at this landscape of, trying to erase our history and trying to erase our impact on this country, I think we have to understand that everything, in my view, comes back to health. And if you are not, and I've seen this up close and personal when I saw my sister, struggling and navigating a cancer diagnosis, if you don't have your health, you don't have anything. And I know I'm talking to the choir, but at the end of the day, this health journey is very personal. It's very personal. It's very individual, but it's also a collective experience. And that's what really excites me about this conversation and the work that we do. We did a special broadcast last week on heart health because February is American Heart Month. And so we had a physician from University of Penn, Dr. Devon, a cardiologist, and he literally said, unprompted, he said, you guys are doing more, because the question was, how do we create more public awareness about health and wellness? We asked that to him. He said, you guys are doing more around public health information than I'll ever be able to do as an individual cardiologist talking to individual patients. And so we have to look at how we leverage not just WURD, but the Tribune, Scoop, the Sunday Sun, the Black media and media, independent community media overall. The Inquirer can only do so much. And, they have a very important role. WHYY can only do so much, but real talk, their audience is not our audience. We center Black people. We center Black experiences. We look at the full humanity and diversity and complexity of the Black experience. We're not just looking at, gun violence, which is critically important. We're not just looking at, education graduation rates. We are looking at the entire spectrum of Black humanity. And that's rare in the media landscape.
So tell me this, though. We want to partner. We want to communicate. How do we keep that relationship authentic? What are mistakes partners make in trying to engage Black media that let folks know they're not authentic in that engagement?
Well, I think that anything, particularly around health, it has to be a long-term investment. It cannot be, one and done. So I really believe, and I'm not just saying this because I'm the CEO of WURD, but really, consistency matters, especially in a very crowded, noisy media market. People are, and I'm impressed, people aren't on their phones like now, but we are in a culture of constant multitasking. And what does constant multitasking mean? You are not absorbing most of what you are listening, reading, watching. And so repetition is really, really important. Cultural competence is really, really important. Making sure that I don't know why this BAFTA Tourette's thing just came into my mind, but making sure that you are solving for things that are potentially going to disrupt or damage your relationship with the audience, and try and be preemptive and try and be proactive. But I think consistency, making a long-term commitment to communicating and being multi-platform. I think that and one of the things I guess I'm proudest about in terms of my journey and tenure at WURD is that we started as an AM radio station, 900 AM. That's what I inherited. And now over these 15, 16 years, we are AM and FM, we are video, we are podcast, we are social media, we are digital, we are events. You have to be in and it makes it much more difficult to be in this media space, but you have to span all of these spaces to be relevant and to have any chance of connecting with your audience. The thing that I think makes us most unique is that we are this two-way talk platform. So it's constant back and forth. We are constantly hearing from our audience and taking that information and translating it into new programs, new products, and new services that empower the community. So, long-term commitment, cultural competence, consistency are the things that I would say.
I know that there are many voices from our community. Some of the stakeholders include other nonprofits. Some of those nonprofits are led by people of color. Kelly Woodland has assembled a group of roughly, how many are in your group, Kelly?
300, 350.
Over 300 people. And that's an important voice. And part of that has to be advocacy, because we are up against what is an historical challenge. How do we turn that advocacy into a platform where we can solidify voices and target things that are doable from a collective standpoint? And what role can radio play in that collective voice, getting that message out? When we can then turn it over to government relations affiliates such as Maven Inc. and Cozen
Well, first of all, I think, I mean, our roots, and we are absolutely a radio station, but at this point, we consider ourselves a media platform. So, and when you talk about how do you aggregate and create more collective and efforts, it makes me think of my other company that I co-founded in 2021, URL Media. URL Media stands for Uplift, Respect, and Love. And it is a network of Black and Brown media organizations like WURD that share content and share revenues to try and create more sustainability for diverse community media organizations. Because as you can imagine, I mean, if you just look at what happened to Don Lemon and Georgia Fort and Jimmy Kimmel and NPR and Corporation for Public Broadcasting and the media is like absolutely under incredible threat right now. And the only way that smaller organizations like WURD have a fighting chance is if we collaborate, if we create collectives and networks. And so, in 2021, this was after George Floyd was murdered, you all remember the racial justice protests, and there was this outpouring of, we need to support Black institutions, Black grassroots community groups and media and everything. That lasted maybe 2 years. Seriously, it lasted maybe 2 years. But out of that moment, me and my co-founder, Mitra Kalita, we started URL Media because I knew that WURD needed to be able to have additional revenue streams. We needed to amplify our content because we create good content, but we are always limited with our resources, human and financial. And so we created this network for very selfish purposes. My co-founder Mitra had her own media company as well. And I knew that in order for us to survive, and this is way before Trump 2.0, in order for us to survive, we needed to join forces. And so we started with 8 media organizations like Friends and Family media organizations. We're now at 40 from across the country: Black, Latino, Native American, Asian American, South Asian, immigrant, 40 media companies that work together to make sure that we can be stronger and serve our audiences with trust and authenticity, but also be able to have this national scale by joining forces together. And I think that is a model for what we can do locally, what Kelly's doing with the philanthropic universe, what we can do locally, what we can do statewide, and what we are doing nationwide.
Thank you for that answer. And it's so interesting to have Sara here and that perspective on what the future may look like as one of the questions I want to have her address. But before doing so, I want to throw out one other opportunity we can look at jointly with other groups. The 3rd Congressional District is up for grabs. And while we stay out of politics directly as a nonprofit, we do advocate for policy that can affect what we do. And I think it would be very interesting if we can come together with WURD, PHMC, Kelly, your folks, and sit together and have a panel discussion on health disparity with these group of candidates. And I think we should hold it not here, but somewhere in the 3rd Congressional District. And I'd be happy to put that on the agenda. I know folks are taking notes. And then I'm going to move to my final question before opening up to the audience, which is, what does history of the future look like for media in regards to advocacy and, more importantly, fighting some of the pressures that we are seeing emanating from a well-organized, less than welcoming opposition?
So what's the future look like?
Well, AI is everything, you know. AI is disrupting and transforming every industry, including the media. So I think that, you know, unknown exactly how AI is going to um, shape or impact the media landscape. I personally believe that the future is community media. It's independent community media that is hyper local, that is serving communities in their own languages with their own trusted messengers, trusted brokers. I think that it is absolutely, you know, depending on the audience, like young people are not listening to radio. They might be listening to our app, maybe, which I hope. They might be listening through our website because we do stream and all of that. But most young people are getting their information from social media. And so one of the things that we are doing with URL and to some extent with WURD is really looking at how do we find that intersection between these creators, these influencers, these people who have millions of followers on TikTok or Instagram or whatever, and people are dedicated to what they have to say. How do we connect that with legacy media? How do we connect that with institutional media? Because I don't even like the idea of legacy media anymore, because if you're going to survive, whether you're legacy radio or legacy TV, you have got to evolve. You have got to transform. And we are. But at the same time, you know, there has to be a coming together between the creator community and the influencer community and those institutions. I like to call them institution building instead of legacy. And so I see this convergence between new media and institutional media. But I think that it's really, really important. A lot of times there's this, we're chasing after the shiny new thing. And so it's like, oh, legacy media, radio's over. People, I can't tell you the number of people who say, you know, isn't radio dead? No, actually it's not. It's not dead. There are very few places where you can get free information by just turning something on anymore. Usually you need an internet connection, and so radio is not dead, but it is evolving. And I think that we have to look at how we reach younger audiences constantly. What are they interested in? What are the platforms that they're consuming information on? And this is for public health folks too. You know, like how are you reaching and having a different strategy to reach different demographics, because our media consumption landscape is completely siloed right now, depending on your age, depending on maybe your geography, but there is a place for all of it. And I see the future as this bringing together these different generational divides, these different media consumption patterns, these different platforms between legacy, new, institutional, and independent. But I think that local, community, independent is the way to go, because the big dogs, I think, the ownership of the big corporate media giants are selling us out. Plain and simple. That's me saying that, not Michael.
Ooh, that's a good transference to an opening questioning period for our audience. So my mic is going to be handed off, and you're going to use this to offer questions. Thank you.
Hi, thank you so much. This is really interesting. My name is Caroline. I work in the Research and Evaluation Group here at PHMC. I'm also a resident of the 3rd District. And so exactly. I was just wondering, does WURD make endorsements? Are you allowed to do that?
We are allowed to do it. We don't endorse local elections. We did endorse in the last presidential election, but we don't endorse in local elections.
I sat on a debate last week between Alice Stanford and David Oxman, and it was fascinating, and it was all healthcare. And all I can say is the messenger matters for the third district, I think. And
Absolutely.
it was amazing.
Yeah, and I love the idea of, I mean, there are a lot of forums and debates that are like scheduled, because obviously the primary is in May, and you know, everybody's scrambling. So but I think one that's specifically focused on healthcare would be great. Yes.
It's Jan Baudu here, organizing inaugural edition of Philadelphia Climate Week this summer, and related to the social determinants of health and where it intersects with pretty much every other issue area. So, and this is for both of you, actually. How are you weaving the whole theme of climate adaptation and resilience into your operations, as well as the messaging, given that, at least here in Philly, despite the fact that compared to many parts of the country, let alone many parts of the world, it's relatively lower in terms of overall climate risks, but still going to be expecting a lot more extreme heat and other climate-related natural disasters in the years ahead, even if all emissions were to stop right now. So how are you weaving this whole questions of social determinants, all those health, weaving that through the climate resilience imperative?
Thank you for that. So in 2018, we launched an initiative called WURD, which was looking at environmental justice, environmental racism in Philadelphia. And so we have a weekly show called WURD Magazine that talks specifically about climate change and environmental racism and all of those things. And just like healthcare, you know, like in 2018, which is a while ago at this point, you know, a lot of people looked at environmental justice as not a Black issue. You know, it was like granola eating, Birkenstock wearing, you know, tree hugging white people, you know, like those are the people that, but we know that if we look at public schools, if we look at old infrastructure and lead in paint and all of the asbestos and the things, poor and Black and brown people are disproportionately impacted, trash and dumping and toxic
and all that.
tree, right. And so we recognized that there was an absolute imperative to raise awareness around this issue of environmental justice and climate change within our community. And so we started that initiative in 2018. It continues today. And we partner with like Bartram's Garden and North Philly Peace Park and, you know, a lot of the Overbrook Environmental Center, like a lot of the environmental organizations around the city.
And I think Sara gave an example. Bartram Gardens is a local example of not only does it provide history in terms of culturally how African Americans transferred subsistence foods hidden in garments on slave ships, and that's come back here, and we adopted other food, and we have a different type of African farming system. I'm just getting that plug in because her family's been very supportive of that garden, and my daughter, who's an environmental engineer, worked there, and now data scientist in terms of that work. Now, how does that culminate in what we do in terms of being earth friendly here at PHMC? There should be a variety of ways. It should be education. It should also be practice, recycling. It should be knowledge and exchange of practices that allow how we do business, and that is being efficient, electricity. That is using space wisely. Going forward, we're not going to be as, how should we say, spacious in how our layout is in terms of our buildings. We are also going to look for ways in which our benefits package can support those earth-friendly initiatives. Those are all ways in which we can embed being a more responsible user of resources into what we do as an employer. And I come from that background because I had a printing company, really a packaging company that was one of the first to embody some of those principles into packaging and went into the fast food industry across the nation. And we used earth-friendly methods. We used substrates and other resources that rejuvenated quickly than typical paperboard. So that's a sweet spot for me. And I was part of the Sustainable Business Network for years. But I've been so focused on some of the immediacy of PHM challenges that we have not put as much commitment to that effort as I would have liked, but it was important. I'm going to begin to wrap up, and I apologize, time flew so quickly, but I have a couple of acknowledgements. First, I want to thank our communication staff and other PHMC folks who under short notice put this together and helped with other. We also had some assistance in terms of sponsorship from the prestigious law firm Morgan Lewis, particularly partner Miss Cortez is sitting in the audience, and she's been very helpful for us. But I want to ask Sara to give some final thoughts and offer some reflections on a path forward. And I'm going to allow her to close out and have the last word. I'm simply going to be asking that we have a call for action. And our takeaway is we're going to engage healthcare leaders, funders, and the public to actively support and engage Black-owned media, right? That's our homework. And we're going to work here personally at PHMC. But let's have Sara close us out with her final thoughts.
Well, first of all, thank you all so much for your time. I mean, you could be doing many, many things right now. So I really appreciate you being here and hearing me out. The most important thing, well, I would say there are two things that I would want to close with. Don't numb out. This is not a time to numb out. This is not a time to, sit on the sidelines. Get in where you fit in. Everybody has different interests and skills and areas of interest and commitment, but do something, because we are living in a very, very dark time. And if you don't think we are, you may not be consuming the right media. Because just right here in Philadelphia, we've got the president's house. We've got, what's happening around the country and here too, in terms of ICE, in terms of people being disappeared. So I was in Miami last week and I met Georgia Fort, who is the woman who was arrested and is being charged for recording and reporting on a protest in Minneapolis. She's an independent journalist. And you may have seen she did a Facebook Live thing as they were at her door with her children in the background about to arrest her. So I met her. She told me she drove from Minneapolis to Miami because she was afraid to fly. A Latina woman from New Mexico said she drove from New Mexico to Miami because she was afraid to fly. Georgia Fort said to a group, it's not a matter of if, it's a matter of when. And I see myself in Georgia Fort. And we should all see ourselves in Georgia Fort. Whether you're Black, brown, white, whatever. Because our democracy, and I'm not trying to be lofty, is under assault. It is under threat. And if we, the people, don't do something, anything that's proactive, we will lose this democracy. So vote. Do something, don't numb out, vote, and listen to WURD. Thank you.
Thank you. Let's give her more applause. And I lied about last words. I have some homework for you. We talked about reading Medical Apartheid. I'm going to give you 4 other books. If you have not read, I heavily advise you look at. The Color of Law, A Forgotten History of Our Government, Segregated America by Richard Rothstein. The Color of Money, Black Banks and Racial Wealth Gap. Our Kind of People, Inside America's Upper Class by Lawrence Otis Graham. And finally, the 1619 Project, a new origin story by Nicole Hannah-Jones. I recommend those books as this is Black History Month. If you're going to commit some time to reading, pick any one of them. Regardless of which one they are, you're going to be better off. Now, again, let's give everyone involved in making this happen. Sure.
I would just recommend another book. It's called The Half Has Never Been Told, which is excellent. The Half Has Never Been Told. It talks about the economic drivers of this nation and how so much of it was grounded in the slave trade. And so it's a very powerful book as well.
All right.